I don't worry. I mean, I think that's going to happen. I mean, the number of lawsuits with my name on it right now is almost beyond counting. So we got everything that we do here. We have excellent general counsel. We know what we do, what we're doing is legal. And if people sue us, they're welcome.
You heard what he just said, and you understand precisely what this moment signifies, because the architecture of cruelty being constructed before our eyes right now, literally this morning on December 18, 2025, represents nothing short of a full-scale federally coordinated assault on the bodily autonomy and medical decision-making of families across this nation. And we need to examine with unflinching clarity what it means when a man who peddles conspiracy theories about vaccines causing autism and transgender people being the result of chemicals in water now sits atop the Department of Health and Human Services wielding the power of Medicare and Medicaid funding like a cudgel against vulnerable children. Health Secretary Robert F. Kennedy Jr. and Dr. Mehmet Oz announced measures in a press conference Thursday that will essentially ban gender-affirming care for transgender young people, even in states where it is still legal, and the sheer audacity of this federalist overreach should alarm anyone who claims to care about states' rights or parental authority or medical privacy, because what we're witnessing is the weaponization of federal funding mechanisms to circumvent democratic processes in blue states that have explicitly protected this care. Listen to the smugness dripping from his voice in that clip when he dismisses the prospect of lawsuits, with the casual arrogance of someone who believes the legal system exists to ratify his prejudices rather than protect constitutional rights. And when he says we know what we're doing is legal, he's banking on a Supreme Court that just weeks ago declined to protect these very rights in the Scarametti decision, a devastating ruling that gave states permission to discriminate and now emboldens this administration to take discrimination national. The first rule would prohibit doctors and hospitals from receiving federal Medicaid reimbursement for gender-affirming care provided to transgender patients younger than age 18, and taken together, the rules could make access to pediatric gender-affirming care across the country extremely difficult, if not impossible, which means that even in California, even in New York, even in Illinois, where legislatures have fought tooth and nail to protect trans youth, the federal government is now saying we will financially strangle any hospital that dares to provide this care. But here's where it gets even more sinister, and you need to understand the full scope of what's happening, because this isn't just about cutting off Medicaid reimbursements for specific procedures. This is about threatening to revoke all Medicare and Medicaid funding from any hospital that provides gender-affirming care to minors, period, full stop. Nearly all U.S. hospitals participate in Medicare and Medicaid, so the agency said hospitals would no longer be allowed to provide gender-affirming care to minors, and that any hospital that did not comply would lose federal funding, making it nearly impossible for young people to access this type of care. Do you grasp what this means in practical terms? Because hospitals cannot survive without Medicare and Medicaid payments. They constitute the financial lifeblood of American healthcare infrastructure, and Kennedy knows this, which is why he's using it as leverage to force institutions in progressive states to abandon trans youth or face institutional collapse. The cruelty here operates on multiple registers simultaneously because not only is this administration attacking the healthcare itself, but they're doing so by mischaracterizing what that healthcare actually entails and flooding the discourse with inflammatory rhetoric designed to provoke moral panic. Kennedy said that so-called gender-affirming care has inflicted lasting physical and psychological harm on vulnerable young people, deploying the language of child protection to justify child endangerment and ignoring that the American Medical Association and numerous other major medical organizations support psychological and medical treatments that help transgender children live as the gender they identify as, representing the consensus of literally millions of doctors who have dedicated their lives to evidence-based medicine. Kennedy condemned the concept of gender-affirming care as junk science, saying this is not medicine, it is malpractice. Otonate, a statement so breathtakingly hypocritical, coming from a man who has made millions peddling thoroughly debunked health conspiracies, that it would be laughable if it weren't being used to justify denying life-saving care to children. And let's be explicitly clear about what the research actually shows, because the scientific evidence is overwhelming and unambiguous despite what Kennedy's HHS report claims. A 2023 study found that gender-affirming medical interventions were associated with lower odds of depression and suicidality, and a cross-sectional survey of more than 20,000 transgender adults found significantly lower odds of lifetime suicidal ideation in those that had been treated with pubertal blockers during adolescence in comparison to those who wanted such treatment but did not receive it. And the Journal of Adolescent Health found that gender-affirming hormone therapy resulted in lower rates of depression, suicidal thoughts, and suicide attempts among older transgender and non-binary teens, which means that when this administration blocks access to this care, they are quite literally increasing the risk that trans youth will attempt suicide, and they know it, and they're doing it anyway, because the ideological project of erasing trans people from public life matters more to them than the actual lives of actual children. The legal vulnerabilities in what Kennedy announced today are massive, and we should be prepared for an avalanche of litigation, because what the administration is attempting represents federal overreach on a scale that should trouble even conservatives who claim to care about federalism and the 10th Amendment. Plaintiffs, including attorneys general of states where gender clinics have recently shuttered, assert that gender-affirming care is legally protected in all of their states, and that federal efforts to block that care violate states' rights provided by the 10th Amendment. This tension between federal coercion and state sovereignty creates fascinating constitutional questions that might actually find some receptive justices even on this Supreme Court, because the mechanism being used here is so nakedly about circumventing state law. The lawsuit argues that the Trump administration is pursuing a backdoor strategy to restrict gender-affirming care at the federal level through threats of criminal and civil penalties while skirting state laws that protect transgender patients' health care, which is precisely what's happening when you threaten hospitals with financial ruin unless they violate their state's laws and medical standards. But we need to zoom out from the legal technicalities for a moment and confront the broader political economy of this attack, because what we're seeing is the convergence of multiple reactionary forces that have been building for years the Christian nationalist legal apparatus, represented by organizations like Alliance Defending Freedom, that have been systematically working to roll back LGBTQ rights through strategic litigation, the right-wing media ecosystem that has spent the last several years manufacturing a moral panic about trans youth using sensationalized anecdotes and inflammatory language about child mutilation to override medical consensus, and now a presidential administration willing to abuse federal power to impose a minoritarian cultural agenda on states that democratically rejected it. The care is already banned in 27 states, which means that roughly half the country has already succumbed to this wave of legislative bigotry, and now the federal government is saying that's not enough. We need to make it impossible everywhere. The timing here is also worth noting because the pivot to transgender minors comes one day after Republicans in the House passed a package of healthcare bills that do not extend subsidies for people who buy health insurance in Affordable Care Act plans, and the legislative package included a bill introduced by Rep. Marjorie Taylor Greene that makes it a crime to provide gender-affirming care to transgender minors, punishable by a fine or prison time of up to 10 years. So while millions of Americans are losing healthcare subsidies and facing higher premiums, Republicans are spending their political capital on criminalizing doctors who provide evidence-based care to trans youth, because this has never been about healthcare costs or fiscal responsibility. This has always been about using state power to enforce gender conformity and punish deviation. The American Civil Liberties Union has announced plans to sue to stop the rules, and we should expect coordinated legal resistance from multiple advocacy organizations, because the constitutional violations here are numerous: equal protection claims, due process claims, violations of the spending clause, which limits how the federal government can impose conditions on funding federalism, concerns under the 10th Amendment and supremacy clause issues when federal rules conflict with state laws. The ACLU stated these gratuitous proposals are cruel and unconstitutional attacks on the rights of transgender youth and their families, and they're right. But we need to be clear-eyed about the timeline here, because even if these rules are ultimately struck down in court, which they very well might be, the process will take months or years, and in the meantime, hospitals across the country are shutting down their gender-affirming care programs for minors, including in areas where access to this care is protected by state law, because institutions cannot risk losing federal funding while litigation plays out. This is the chilling effect in action, and it's precisely what Kennedy and Trump are counting on, because even if they lose in court eventually, they will have succeeded in disrupting care for thousands of young people during the years it takes to get a final judgment, and some of those young people will not survive that disruption. Approximately 26% of U.S. transgender and questioning students surveyed by the Centers for Disease Control and Prevention in 2023 said that they had attempted suicide during the prior year alone, and research consistently shows that access to gender-affirming care can reduce this risk, which means that every day this administration successfully blocks access to care is a day when trans youth are at elevated risk of self-harm and suicide, and that blood will be on the hands of Kennedy and Trump and every Republican legislator who has enabled this campaign of state-sanctioned cruelty. Let's also talk about the rank hypocrisy of the parental rights rhetoric that conservatives have weaponized in debates about education and healthcare, because suddenly when parents want to support their transgender children and seek appropriate medical care in consultation with doctors, the right discovers that actually parental rights don't matter, and the government should override families' medical decisions. Advocates said families deserve the freedom to go to the doctor and get the care that they need, and to have agency over the health and well-being of their children. But these proposed actions would put Donald Trump and RFK Jr. in those doctors' offices, and this exposes the fraudulence of the entire conservative project around parental authority, because it was never about empowering parents. It was always about empowering parents to do what conservatives approve of, and punishing parents who deviate from conservative gender ideology. The medical consensus here could not be clearer, and Kennedy's dismissal of it as junk science is projection of the highest order, coming from a man whose entire public career has been built on anti-vaccine conspiracy theories. Major mainstream medical associations, including the American Medical Pulparent Association, the American Psychiatric Association, the Endocrine Society, the American Psychological Association, the American Academy of Pediatrics, and the American Academy of Child and Adolescent Psychiatry, have supported such care and agree that it's the gold standard of clinically appropriate care that can provide life-saving treatment for children and adults, and the American Academy of Pediatrics states there is strong consensus among the most prominent medical organizations worldwide that evidence-based gender-affirming care for transgender children and adolescents is medically necessary and appropriate, representing literally thousands of pediatricians who specialize in caring for children and understand developmental medicine far better than Robert F. Kennedy Jr. ever will. But Kennedy has signed a declaration asserting that gender-affirming care for minors does not meet professionally recognized standards of healthcare, based on a report whose 9 authors are most known critics of gender-affirming care. A Yale adolescent medicine specialist says, now that the authors have announced themselves, they can be identified as engineers of a cottage industry that solely exists to dismantle healthcare for a vulnerable group of people, which tells you everything you need to know about the intellectual integrity of this supposed evidence review. Because when you cherry-pick your reviewers from the ranks of ideological opponents of the care being reviewed, you're not doing science, you're doing advocacy dressed up in the language of research. And here's what makes Kennedy's position particularly galling beyond the junk science, beyond the conspiracy theories, beyond the arrogance in that clip where he dismisses lawsuits as beneath his concern. RFK Jr. has falsely described essential transition-related care as castration drugs, ignoring decades of research confirming the safety and necessity of transition-related treatment in reducing suicidality and improving mental health. He has made unsubstantiated claims that the existence of trans people is the result of chemical exposure from drinking water based entirely off a single study conducted on frogs, which would be laughable if this person weren't now the Secretary of Health and Human Services, with the power to shape federal healthcare policy and deny life-saving treatment to vulnerable populations. The administration is also moving to strip protections from trans people in other contexts, as part of this coordinated assault, because Kennedy said the administration would no longer classify gender dysphoria as a disability, which will remove civil rights protections under Section 504 of the Rehabilitation Act. Kennedy said the Food and Drug Administration would be issuing warnings to manufacturers of breast binders, threatening to seize products and impose significant regulatory violations if they are illegally marketed to children, as if chest binders which trans-masculine youth use to alleviate dysphoria represent some kind of public health crisis requiring FDA intervention, while opioid manufacturers faced minimal consequences for creating an addiction epidemic that killed hundreds of thousands of Americans. The strategy here is totalizing erasure, using every lever of federal power to make it impossible for trans people, especially trans youth, to exist safely in public life. And when Kennedy says, the American Medical Association and American Academy of Pediatrics peddled the lie that gender-affirming care is beneficial for children, he is calling the most prestigious medical organizations in the country liars, because their evidence-based conclusions contradict his ideology. Many research studies refute this. So who are we supposed to believe, the collective expertise of the American medical establishment, or a conspiracy theorist with a brainworm who thinks vaccines cause autism? Let me tell you what's really happening here, beneath the rhetoric about protecting children, because this has never been about medical evidence or child welfare. This is about the Republican Party discovering that anti-trans sentiment polls well with their base, and provides a useful culture war distraction from their unpopular economic policies and their inability to govern effectively. The Human Rights Campaign noted this is the latest example of the obsession the Trump administration and their MAGA enablers in Congress have with attacking the transgender community. And just this week, the U.S. House of Representatives took up 2 separate bills to target healthcare for trans youth, including a bill that could put doctors and parents in jail for 10 years instead of tackling expiring ACA tax credits, which perfectly encapsulates conservative priorities: criminalize healthcare for trans kids while letting healthcare become more expensive for everyone else. The hospitals closing their gender clinics right now aren't doing so because the care is dangerous or ineffective. They're doing so because the result is an atmosphere of fear and intimidation experienced by transgender individuals, their families and caregivers, and the medical professionals who seek only to provide necessary lawful care to their patients. Burnell, and this chilling effect is intentional because the Trump administration knows that even if they lose in court, they can terrorize providers into abandoning their patients through investigations, subpoenas, and threats of federal prosecution. The Justice Department announced at least 20 subpoenas into clinics involved in gender transition care, alongside subpoenas to drug manufacturers and investigations into hospitals, and doctors are being subpoenaed for patients' private information, which represents a massive violation of medical privacy and the physician-patient relationship. What Kennedy is doing with that dismissive shrug in the clip, that little laugh when he says he's already buried in lawsuits, so what's a few more, is performing the impunity of power and signaling to trans people and their families that resistance is futile because the machinery of the federal government is aligned against you, and you should just give up. But that's precisely why we cannot give up, because New York Attorney General Letitia James said the federal government is running a cruel and targeted harassment campaign against providers who offer lawful life-saving care to children, and we will never stop fighting for the dignity, safety, and basic rights of the transgender community. And that commitment to sustained resistance across multiple jurisdictions and through coordinated litigation and legislative action in blue states that retain the power to protect their residents is what stands between this administration's authoritarian impulses and the complete erasure of trans youth from public health care. The legal arguments against these rules are strong because the approach contradicts the recommendations of most major U.S. medical organizations, and courts have traditionally been reluctant to allow political branches to override medical consensus, especially when doing so causes demonstrable harm to vulnerable populations, and because the mechanism being used here, federal spending conditions imposed in ways that coerce states into abandoning their own policies, potentially violates the anti-coercion doctrine established in cases like NFIB v. Sebelius, where the Supreme Court held that Congress cannot use financial pressure to compel states to adopt federal policies. The irony of conservatives who screamed about federal overreach during the Affordable Care Act debate, now cheering as Trump uses Medicaid funding to override state healthcare decisions, should be noted and mocked relentlessly. But beyond the legal maneuvering, we need to maintain moral clarity about what's happening here, because this is a campaign of state-sponsored cruelty aimed at some of the most vulnerable young people in America, kids who already face discrimination, bullying, family rejection, and epidemic rates of suicidality, and this administration's response is to make their lives harder, to strip away the medical care that research shows reduces their risk of self-harm, to terrorize their doctors, to threaten their hospitals, and to do all of this while claiming to protect children. The president of the American Academy of Pediatrics said allowing the government to determine which patient groups deserve care sets a dangerous precedent, and children and families will bear the consequences. Pultism Live, because once you establish the principle that the federal government can override medical consensus and deny care to disfavored populations based on ideological grounds, you've opened the door to all manner of healthcare discrimination. Trans youth and their families are watching this unfold right now today as we speak, and they're terrified because, according to the Trevor Project's 2024 national survey, 90% of LGBTQ young people reported that their mental health has been negatively impacted by recent politics, and that's before this latest escalation, before the Secretary of Health and Human Services announced he's going to financially strangle any hospital that tries to provide them care. Families with transgender youth across the country have already taken the dire step of leaving the United States for fear of exactly this kind of proposal becoming the law of the land, which means American families are fleeing the country seeking asylum from their own government's persecution, and that should shock the conscience of anyone who believes in human rights or religious freedom, or any of the other principles conservatives claim to hold dear. So when you watch that clip and you hear Kennedy's casual dismissiveness about the lawsuits that are coming, understand that what you're hearing is the sound of authoritarian contempt for the rule of law, and for democratic accountability, and for the lives of transgender children who this administration views as acceptable, collateral damage in their culture war, and understand that the fight ahead will be long and difficult because this administration has signaled its willingness to use every tool of federal power to pursue its eliminationist agenda against trans people, and understand that we must meet that cruelty with sustained organized resistance coordinated across state and federal courts through advocacy and legislation in blue states that still retain the power to protect their residents through mutual aid networks that support families whose children have been denied care, and through relentless public pressure that refuses to let this administration normalize the denormalization of transgender existence. The lawsuits are coming. Yes, Kennedy is right about that. But what he doesn't understand, or perhaps he does, and simply doesn't care, is that every lawsuit represents families fighting for their children's lives, and no amount of smugness or federal power can extinguish that fierce protective love that will fight through every court, and every appeal, and every bureaucratic obstacle, until justice prevails.